New the relationship chat.
Who's introducing?
Hello, everyone. This is Bishara Ghawi, Deputy Executive Director from Mentor Arabia in Lebanon. We are launching today and now through this webinar, ISSUP Lebanon Chapter, International Society for Substance Use Professional. I'm very happy to be representing Mentor in this webinar, where Giovanna from UNODC will be giving a very interesting webinar about the latest best practices, WHO and UNODC standards. And I'm happy also now to introduce Jeff Lee. Jeff Lee also will talk a little bit about ISSUP International and what has been done so far and what are the next steps. In Lebanon, I invite everyone who is listening from Lebanon to register and to go to ISSUP website and to ISSUP social media on Facebook and Twitter and LinkedIn to stay posted about our next activities, and expect lots of interesting webinars soon. And hopefully after Corona, we will be doing some on-site conferences. Thank you, Giovanna. Thank you, Jeff Lee. And now I'll turn my camera off and leave the word to Jeff Lee.
Thank you very much indeed for that introduction. I was given 2 minutes to speak and say my piece because the Lord Mayor's show is Giovanna, but I just wanted to say a few words because it's a sincere pleasure for me to represent ISSUP Global, to formally welcome Lebanon to the ISSUP family as the new ISSUP Lebanon. I'd like to thank Mentor Arabia for being prepared to operate as the host organization for the work of ISSUP Lebanon. We trust that ISSUP's role in promoting evidence-based, high-quality and ethical policy and practice in our mission to professionalize the drug demand reduction workforce is in good hands here in Lebanon. We really believe it is. Through you, we hope we can support the development of the work that is undertaken in prevention, treatment, recovery in your country. It's a particular privilege for me to be allowed to offer you this welcome. I visited Beirut on 4 occasions during my career. None of them has been without incident, but I won't get into the details. But I would say they remain in the easily remembered part of my memory box. 3 things stand out from those visits, as well as the wonderful food, by the way. The beauty of the city and the country, even if driving in Beirut was a little stressful. The professionalism, dedication and commitment of the people and the organizations I met with and with whom I worked in the drug demand reduction field. And most importantly, the warmth and enthusiasm of the people who I met. The last 2 points are perfectly reflected in the way those in Mentor Arabia have communicated in the development of ISSUP Lebanon, including the government people with whom I have met over the last year. Enthusiasm, warmth, friendliness, alongside commitment and professionalism and dedication to the cause of addressing substance use disorders. And this within a country with so many challenges, epitomized by the tragic recent events of the explosion in Beirut. In spite of this, and with the circumstances where so many of us would just give up, the Lebanese people I know and respect have been an inspiration in how they have responded. I know we have the input to come from Giovanna Campello from UNODC, a legend of drug demand reduction, let me say, Giovanna. But I know also that her colleague at UNODC, Wadi Malouf, also epitomise the commitment, friendliness, professionalism and support that is provided by the Lebanese people. I've met and had the pleasure to work with so many people, and I have to mention the wonderful input from Anthony Abizaid, Noor Madam, and the support from Thuraya Ismail, the Executive Director of Mentor Arabia, in establishing ISSUP Lebanon. These people and our Lebanese colleagues will be a tremendous asset to ISSUP, and we warmly welcome them to the ISSUP family and the operation of our national chapters. We hope all listening will become members of ISSUP, ISSUP Global and ISSUP Lebanon, and be part of the family doing all it can to address the issue of substance use disorders among our people. Welcome and thank you.
Give me 1 second. It doesn't work. It does, it does. Can you hear me? Jeff, can you hear me?
Sorry, yes, we can hear you, Giovanna.
Okay, thanks. I was just double checking because I have only the presentation in front of me and I don't see you anymore. So first of all, thank you so much for the kind words. Thank you for introducing this seminar, and thanks for having me. And above all, congratulations. I have to say the colleagues at ISSUP Global, Jeff, Livia, Joanna, they've been doing a tremendous work all around the globe in inspiring and mobilizing network of people that believe in evidence-based drug prevention and treatment and want to improve it. And it's great to be able to be here and welcome ISSUP Lebanon. And thank you, Mentor Arabia, for, of course, Jeff has already expressed his thanks on behalf of ISSUP Global for hosting ISSUP Lebanon. And it's funny, Jeff, I had in my notes exactly something that you said, that ISSUP Lebanon is in great hands with Mentor Arabia. I've known Mentor Arabia for a long time, and their commitment to evidence-based preventions has been outstanding for a long, long time. They've been one of the first organizations that I've ever known to say, yes, we will take an evidence-based program and translate it and adapt it for our audience in our region. So as Jeff, I'm in no doubt that ISSUP Lebanon is in amazing hands. And to all of you that are connected today, well, I commend you. I commend you for your interest in evidence-based prevention, evidence-based treatment, for your interest in the health and well-being of children, youth, and communities. And I really, really hope that my words will be at least of some inspiration, some ideas on one specific issue, which is prevention. Of course, the work that we do is so much larger, but for today, allow me to concentrate a bit on prevention, and particularly, as was mentioned before, on the prevention standards. And before I start to tell you what there is in the standards, let me tell you a tiny bit on how and why we developed the standards. I promise I'll keep it short, it's relevant. So one of the reasons why we created the standards is, I tell you a little story. I have been working in UNODC for quite some time, studying prevention, and I knew that there was a lot of science and a lot of science showing that prevention was effective. And then I was in a meeting with many delegates from all over the world, and the delegate of one country, which I will not name, said to me, what are you talking about? Prevention doesn't really work, does it? And that's where I realized that all of this science that I knew existed, very few people knew that it existed, and very few people knew that the power and the force that evidence-based prevention can be. And that's why we said to ourselves here at UNODC, no, we have to sit down and really summarize the evidence to put it at the disposal of everybody. And I believe, yes, in these slides, you can see our first edition. It is the light green one in 2013. And today I will talk to you about the second edition, which is the dark one. We presented it in 2018, and together with the World Health Organization this time. And what I want to tell you in terms of how we developed the standards is that we were not alone. Of course, we were with WHO that has very rigorous methodologies, right? So that you can be sure. But also we had more than 100 experts from 47 countries involved. And I collected studies from all over the world. I told everybody, I don't care, give me a study in any language, I will find a way to translate it. And this is the kind of study that we were looking for. We were looking really at studies that showed whether an intervention was effective in preventing use. So for example, if you look at this is the graph of a study on an intervention that is given to children that are 2 to 5 years of age. Yes, you have heard right. 2 to 5, they are in kindergarten. And this intervention, this study followed some children in the blue bar until they were 21. And then they also follow some children that did not do the program. They are in red. And you can easily see how at 21, the children that had done the program when they were very, very small, they used marijuana less. There was less prevalence of teenage pregnancy, and they were better enrolled in college and university. So when I said we were looking for studies that looked at the effectiveness of prevention, this is the kind of studies that we were looking for. Not studies that were saying, oh, the children were very happy to participate in the program. Oh, the children were very interested. No, really studies that showed that as a result of the program, less children started to use, less youth started to use, okay? And what did we find out? Well, I'll give you some general idea, a more general idea, and then I go a bit more in the specific. I think that the main point is that what we found out is that we really need to change our perspective on prevention. So traditionally, people think like this. People do not know that drugs are dangerous, so they start to use. That's why they start to use. And therefore, prevention means providing information to children on the danger of drugs. Okay, and there is some truth in that. Look at this is a graph that is very famous and looks at, if you look at the blue line, is how much youth in the United States believed that cannabis is harmful. And the green line is the actual use of cannabis. And you can see that if youth believe, the more youth believe that cannabis is harmful, the less use there is, and vice versa. The graph is also almost a mirror, right? And so there is a great importance and a great place for providing information about how dangerous drug use can be. But that is not the only, that is not the end of the picture. The picture is much more complex and much more exciting. So look at this. This is, for example, another graph that shows you that the higher the monitoring by parents of the children, the less likely children are to use. So parents, their parenting, the way they are parents is also very important protective factor. We know that being in school matters. This is a graph that shows, that compares youth, they are about 18, and you can see that when they are out of school, so the dark line, they are much more likely to use any psychoactive substance. This goes for tobacco, alcohol, and other drugs, than the students who are still in school. We know that adverse childhood experiences matter, and inequality matters very much. So we know that adverse childhood experiences such as neglect and abuse are associated to higher rates of use later in life. But look at how this connects with inequality. If you are on higher income and have been exposed 4 or more times to adverse childhood experiences, you have 4% of these people will have a substance use disorder. Okay, but if you're lower income and you've been exposed to 4 or more adverse childhood experiences, you're 3 times as much likely to have a substance use disorder. So inequality matters a lot. So this means that if you remember this arrow that I showed you before, this first part is much more complex. It's not only people don't know the dangers of drugs, people start to use. It's much more like this. There are many influences in the environment and in the person that can increase the vulnerability of people to starting to use drugs. It could be in the family, in the school, in the physical and social environment. And this was a older version that we produced in 2014, and more recently the World Drug Report this year produced this nice picture that shows you the balance between the protective and the risk factors. The other important thing that we know from the science is that these vulnerabilities are at personal and environmental levels. As I was saying, it could be in the family or in your socioeconomic situation. But the important thing to remember is that these vulnerabilities are common to many risky behaviors. This is a graph from very old research in 1992, but it's still very good and valid. And it shows, as you can see, risk factors at the individual level, in the school, in the family, and in the community, and whether they're relevant for different risky behavior: substance use, delinquency, teen pregnancy, school dropout, violence, depression, and anxiety. And you can see that many are common to more than one risky behavior. Now, this is interesting, but it's very, very important because it means that it changes also the last part of the arrow. So first of all, it's not prevention equal information. It means that if you see, this is the list of interventions that have been found in the standards to be effective in preventing drug use. And you can see there are many. It's not only one, right? There are many in many different ages, if you see the top, and in many different settings, if you see the left side. And the great thing is that they do not only prevent drug use, but many risky behaviors. Because, you know, these vulnerability factors are common. If you attack the vulnerability factor, you will not only have less substance use, but you will have less mental health problems, less violent behavior and delinquency, better school performance, less risky sexual behaviors. We are really talking about supporting the health and safe development of children and the well-being of youth and adults. Really holistic, really the entire person. And this is really great. The other thing is that, of course, from science, we have found out that science-based prevention, evidence-based prevention is cost-effective, and there are many different, how can I say, calculations. And this is a very conservative calculation that for every $1 that you spend in prevention, you save at least 10. In reality, there are many calculations that say that you save so much more, but I'm giving you a very safe and conservative figure that you can highlight to your policymakers when they have to give you money for evidence-based prevention. So how does evidence-based prevention look like? And normally I have 3 days to explain the standards to you, so, and I realize that this is a bit long. So I have organized the presentation around a few messages, right? And I will go through them one by one. The first message is evidence-based prevention looks like this: the earlier, the better. So we have seen already, you know, there was a very good intervention that was effective, even with children in kindergarten, but you can start much earlier. In fact, you can start during pregnancy. And there is an intervention, a kind of intervention like prenatal and infancy visits, where a trained nurse or a social worker visits mothers-to-be and new mothers to provide parenting skill and address a range of issues. It could be health, housing, employment, legal, essentially to support the mothers. Of course, this is a very intensive kind of intervention, and you cannot, it would be great, but you cannot offer it to all women. You normally work with women in particularly difficult circumstances. And this has been proven effective, and it has been recommended by WHO to prevent child maltreatment. Of course, you can also work with all pregnant women, and you have to, particularly as recommended by the World Health Organization, by the WHO, all pregnant women should receive advice on the potential risk of substance use during pregnancy to themselves and to the babies. And if there is any evidence of possible use or even disorder, you can and you should offer treatment as a matter of priority, evidence-based treatment, voluntary treatment, because this is effective. I've lost the, sorry, what did I do? Yes, because this is effective for the mother and for the baby. And we have excellent guidelines developed by WHO on this. Moving on to older kids, you can work with children between 2 to 5 years of age and provide early education to really support the social and cognitive development of children from deprived communities. And this is the intervention that I was telling to you about before. It's very effective in preventing drug use and other risky behaviors, and promote mental health, social inclusion, and academic success later in the life of the children. So really, you can start very early. You can, for example, there are also interventions in primary school, and I want to show you one because it's very important. This is a Classroom Environment Improvement Programs. It's a terrible title, I'm sorry. We could not find a better title. But basically, these are programs that teachers do while they teach something else. Let me see if I have an example. Yes, there it is. And where they do a game on behaving well, and they reward the good behavior of teams. So the children help each other, right? And they ignore the bad behavior. The key is rewarding the good behavior. And this very simple kind of intervention has been found to decrease behavior in the classroom, including disruptive and aggressive behavior, strengthening pro-social behavior, improving academic performance, and in the long run, also decreasing substance use. And look at this graph. This is incredible. This graph shows you the probability of using drugs at age 21. So yes, this intervention happens in primary school when the children are young, 7, 8, something like this. And the blue line has done the program and the red line has not done the program. But on the horizontal axis, you see, what do you see? You don't see the age, you see how much the children were aggressive in primary school. So you can imagine when a child is aggressive in primary school, the probability that he or she will get into risky behaviors is very, very high. And at the same time, it's very difficult to address this without stigmatizing the children. You don't want to say, you are very aggressive, come with me for a special class. You don't want to say that. And the great thing about this intervention is they offer it for all children, no distinction. But even the children with very high aggression in primary school were using less at age 21 than those that did not do the program. And this is really incredible because it means that a simple intervention for everybody is also very effective for risky populations. So I hope I've convinced you a bit that it's good to start prevention early. Another thing that is good according to the science is really to focus more on the development of the child more than providing information about the dangers of drugs. As I told you already, dangers of drugs is important, but it's not the end of the story, and I want to give you some examples. So for example, let's look again at what you can do in terms of personal and social skill education in primary school. These are programs where trained teachers engage children in interactive activities to learn how to cope with difficult situations in a safe and healthy way, how to regulate their behavior, develop their social competencies, and in short, develop their personal and social skills. And I give you an example. This is a very famous program. There are many others. It's called Incredible Years. And the children have 7 sessions. Each session is about a different dinosaur. And for example, this is the session of the turtle, and it's all about anger management. So the children are taught to recognize when they're angry, to think stop and take a deep breath. Do like a turtle, go into your shell and tell yourself, I can calm down, and then come out and try again. So you see games and easy tips for children to learn how to regulate their behavior and cope with difficult circumstances. And this kind of intervention has also been found to be effective in preventing substance use, including drug use, and has been recommended by WHO to promote the mental health in children and adolescents. Another thing that you can do to develop, to foster the development of children is, of course, work with their parents and teach parents to be better parents. And I will spend some time here because I think it's very, very important. So parenting and family skills programs are programs that help parents be better parents in very simple ways. No lectures, no psychological jargon, games, things to do together to develop that attachment at the warm style of parenting that is the best protective factor in the lives of children. And this is relevant for children in primary school, but also young adolescents, so 11 to 14 years of age. Normally, parenting skills focus on 3 things. One is increase the family bond, the attachment between the parents and the children. I already mentioned that. 2 is to teach children, parents how to monitor and be involved in the lives of their children in a positive way. We have seen before how important that is. And then, of course, how to set limits and discipline children in positive and developmentally appropriate ways. So just to give you an idea of what we do as part of one of our programs, for example, there is an entire activity for parents and children on learning how to recognize and deal with your own stress, and also recognize stress in the other. So children learn how to recognize the stress in parents, and learn to recognize that if sometimes parents are tired and snappy, it's because of stress, not because they not to take it personally, and vice versa. And then the children and the parents do this exercise separately, and then they come together. And they learn, and they try to recognize stress in each other, and try to think, do you think the parents are better at recognizing the stress of the children, or are the children better? I give you 1 second to think about it. But then I can tell you that the children are much better than the parents. And this is always a very, very moving exercise when we do it. That really helps the family function better, and really helps strengthening that bond between the parents and the children. And we don't do these things only because they are nice, but because they can prevent substance use, including drug use, and because they have been found to be effective in preventing child maltreatment, in promoting the development of children in very poor and risky circumstances, and even manage behavioral disorder in children and adolescents, and prevent youth violence. And we know this is from our own work around the world. The family skills training are effective also in very violent communities. They are effective in very poor communities. We have trialed some family skills program among refugees, displaced populations, and we have seen a great improvement in the behavior of the children. We know that family-based prevention is effective for both girls and boys, and not all prevention is like that. And this is an example of how this is effective for girls. And this is, again, how it is effective for boys and girls. And as I said, this has been recognized by WHO as an effective tool in preventing violence, particularly youth violence and child maltreatment. And this is so important that UNODC has developed our own prevention programs that are tailored to low and middle income countries, and they are in the public domain. And our office is working to introduce it in Lebanon too. These are our 2 programs, Strong Families and Family United. But also this is so important that we have developed new resources for parents on how to parent during COVID-19 in a positive way. We recognize that the pandemic has created enormous stress in families, enormous stress with parents. And in fact, we have seen, unfortunately, the rates of violence against women and against children go up. But we think that there are easy tips that parents and everybody can use to cope with stress in a positive way, and in a way that enhances the resilience of children and doesn't create more dysfunction in the family. And these are all at the disposal of everybody in many, many languages. So I hope that I have given you some idea on how we can, with evidence-based prevention, develop child development. Let me look a little bit how we are doing with time. I am a bit late, so I need to go a bit faster. One The next message is about never too late. So I just want to bring to your attention the fact that there are many interventions that have been found to be effective also for young adults and older adults like myself and many of us. And just to mention them, and we can go into more detail if needed, but of course there is screening and brief intervention, and then there is a lot that can be done in the workplace, as well as, I didn't put it here, but in entertainment venues. And I can speak more about that if need be. The other thing that I need to bring to your attention in a bit of a quick way is the need for using an evidence-based program, or at least a program with evidence-based characteristics. And I've already mentioned how Mentor Arabia, when they wanted to introduce prevention in schools, they took an evidence-based program, which is called Unplugged, and adapted it rigorously and used it in the region. And I know that you will have an entire session about that, so I will not speak to you about it, but just to bring it as a good example. But there might be, and this is what we do all around the world. For example, in prevention education, this is Unplugged. And this is Lion's Quest, which is another program that we use. But one thing that I want to tell you about is, what do you do if you cannot access an evidence-based program, and how you can use the standards to at least see that you are on the right track. So in the standards for each one of the interventions, you can see what works and what doesn't work. So for example, in the standard, you will see that if you want to do preventive education for adolescents, what works is to work on personal and social skills, be interactive, be very structured, use facilitators that have been trained a lot, not use only lectures, not focus only on self-esteem, and so on and so forth. And so you can use the standards and compare your existing program to what is in the standards to learn if at least you are in the right track, and you at least try to move to a green situation as close as possible to the scientific evidence. And lastly, one of the things that I would like to highlight is the fact that we need to work in many settings and not only many ages. And I want to give you an example here where you can see that kids were followed from 6th grade to 12th grade. So from when they were about 12 to when they were about 18. And the kids in gray did not do anything. The kids in green only did an evidence-based program, and you can see that the prevalence of, in this case, the non-medical use of prescription opioids was lower. But if you added family-based programs, it was lower still. And we know from the standards that you can work in families, schools, in the health sector, in the community, including the media, in the workplace and entertainment venues. It's a really rich menu. Here they are. You can see all of the settings where you can work. And I think that's all. And I will close here. And I'm just hoping that I've given you some ideas on how great evidence-based prevention can be, on how effective it can be, and that I've inspired you to pick up the standards and look at them and maybe not understand anything and call me and say, Giovanna, what does this mean? Or maybe understand everything and put it in practice, because ultimately that's what we want. We want a better place for everybody. I'm sorry, my battery is now running low, but I will take care of that in a second. And because ultimately this is what we want. We want children and youth that develop healthy and safe, and adults and communities that are healthy and safe. So with this, I thank you. And there it is. Here are my contacts. If you want to follow us on Twitter, if you want to write to me as As Jeff mentioned, in fact, my team has an amazing person from Lebanon, and he has been the coordinator of all of our work on families and in schools. So there is somebody that really understands your country in my team, but we accept questions in any language, and we will try to support it in any way we can. Thank you so much, and I give the floor back to whoever is in control for the question and answer session.
Hello, everyone. First, before asking the questions, I would like to thank Jeff and ISSUP team for their continuous support in helping Mentor Arabia establish ISSUP Lebanon chapter. I would also like to thank you, Giovanna, for being the guest speaker for ISSUP Lebanon's first webinar. We received many questions, actually. I will try to go through all of them with the remaining time that we have. Sure. We can go one by one, Giovanna, if you want. I can ask you a question.
As you prefer.
Yes. Okay. So the first.
You have many.
Okay. So the first question is someone from Nigeria. As a social worker in the area of drug abuse, how do you introduce parenting skills to parents whose norms are very crude?
Whose norms?
Are very crude.
Mm-hmm. So the problem with family skills, with parenting programs, is the first session. Because parents do not understand, they are very busy. But if you pull together that first group, the world will go around and parents will be encouraged to come. We have been working all over the world, including in Nigeria, on family skills, and in Kenya and in South Africa, just to give you some countries that are near to the Nigeria experience, maybe not the same, obviously, but nearer than me, for example. The activities are very simple. There is no big lecture or anything. It's really only about taking care of children. And of course, all the parenting programs need to be translated and a bit adapted to the local culture. You cannot parachute them like this, right? So, and we have found them to work even in very difficult circumstances. So I am confident that it would work also in the Nigerian setting. What I can do is to put the colleague in contact with our colleagues in Lagos and in now, sorry, the other, the capital name, Abuja, because they have the local materials.
Can I be cheeky and just add that ISSUP Nigeria is in existence, and perhaps contact through ISSUP Nigeria might be of some help too?
Yes.
Thank you.
And the second question is, quarantine during the COVID-19 pandemic, what programs did the organization have for educating children in regards to drug prevention around the world?
We did not manage to do program for children because for us during the lockdown, we immediately started to receive reports of increase in stress and violence within the families. And so we have concentrated on supporting parents, I have to say. And so there is a lot of resources that we have for children and parents on how to cope with stress in a positive way.
Okay. How can the program integrate the education at school and at home effectively for children in the elementary? Is there any training scheme?
There is not a global training scheme also because, you know, especially education is very much a domain that where national governments and national and local communities want to have a say. I have shown you the result and how to combine work in the school with work with the parents is really more effective than just one of the two. And for example, the Incredible Years, which is one of the programs that I presented, has a thing for schools, for children in school and for the parents. And other than that, there are many evidence-based programs for schools and for parents that can be combined. But the combination needs to be done at the local level.
What prevention programs are effective for high-income individuals?
It depends on which age we are talking about. If we're talking about very young children, what I have talked to you about, screening for use in parents, and providing personal and social skills to the schools and to the parents is as good for high income as low income. Bad parenting and family dysfunction does not discriminate. It happens also among high income families, and it's one of the most important vulnerabilities that you can work on. And I would concentrate there, first of all.
How do you suggest that program developers monitor and evaluate the effectiveness of their programs?
That's an excellent question. So that is one of the reasons why I recommend that, if possible, to use an evidence-based program. Why? Because an evidence-based program has already been evaluated. And therefore, all of the instruments to do your evaluation are ready. And to develop those instruments is really not easy. So that work is done for you. And other than that, each developer, you know, or if you are developing a program from scratch, you would have, and if you don't, that's very bad, you would have a theory of change. So a theory of what you are going to change so that the children use less. And you would need to measure this intermediate variable. So what do you need to change? Youth participation, family dysfunction, better parenting, better schools, whatever it is, and measure your effect on the use. And always, always, always have a control group, because otherwise you will not be sure that whatever result is really due to your program and not to chance. So evaluation is really tricky. And that's why I always recommend to use an evidence-based program, because it makes other things also easy, but also evaluation, it makes it easier.
Okay, and could you recommend any tools or resources that the field can use to communicate these standards within prevention to lay people, as in people who are not in the professional field of prevention?
For lay people, that is not so easy. So, of course, ISSUP is the custodian of the Universal Prevention Curriculum. And the universal prevention curriculum is completely based on the standards and is for professionals that either work really as managers of prevention, coordinators, or they work at very even in a lay capacity with families, with students, and so on. So those are already excellent tools. Some of the programs that we use, like Strong Families, are designed to be delivered by anybody. You don't need to be a psychologist. Any parent well-trained can deliver them to other parents, for example. And other than that, we are developing a couple of online simple brochure, I don't know how to call them, IEC materials, to summarize a bit the standards that might help people and understand the standards, even if they are not professionals of addiction, professional prevention, and so on.
Okay, and the next question is, based on established evidence, are school-based prevention programs that target children found to be more effective than those that are not school-based?
They are not, how can I say, they're not more effective, but there is more evidence for the school-based programs than the outside of school-based programs, meaning there are more studies. It's not that there is evidence that one works better than the other. It's just that there is more evidence in school-based program compared to non-school-based. And indeed, so you can see a few. And for example, some colleagues had come to us saying, you know, what do you do with at-risk group, people that are not in school? And I say, to be honest, the science says nothing. But so what we did was to take an evidence-based program and adapt it to the outside of school setting. In fact, it was adapted to the sport setting. And we now have a good program called Line Up Live Up that is delivered through sports for high-risk groups out of school. And they are doing the studies, and there are promising results. It's still not evidence-based, but there are promising results all around the world. So there are less studies. It does not mean that you should not work out of school. To the contrary, people out of school are probably more vulnerable. And if you do, please let us join forces and let us evaluate your program very carefully, so that if it works, we can export it all over the world, because there is a huge need.
Okay, and the next question is, can we rely on online interventions during lockdown?
The $1 million question. I don't know. I don't know. So first of all, before lockdown, already, of course, social media was becoming so important in the life of children and youth, right? And the science is great, but where the weak point of science is that it takes a bit of time. So there is no, I don't have, you know, good studies on online interventions. I know that there is one that is ongoing now that started before lockdown in the UK, and I'm waiting for their results. Other than that, there are many people trying to do things online and evaluating, but we still don't know the results. Again, we need to try and evaluate so that we know what works and what does not work. In lockdown, you know, online was the only thing we could do. So we did it. And we are trying to document as much as possible whether it worked or not. But I cannot say, yes, it works, because we don't have that evidence. but I still think there is a worthwhile effort. And again, if you are launching a large-scale initiative during lockdown or online anyway, again, let us join forces and document it so that everybody can learn all around the world from your great experience.
Thank you, Giovanna. Is it possible for you to, one of our attendees is asking if you can expand more on Inspire?
Yes. So Inspire is an initiative of the Violence Prevention Alliance, which is a partnership led by WHO and UNICEF. But there has a lot of organization there, the World Bank, us, and civil society organization, and so on, huge alliance. And they have done a lot of work on violence in general. But Inspire is on violence against children, particularly child maltreatment. And what they have done is a very systematic review of the evidence of what works to prevent child maltreatment. And the result is that there are, now I don't remember, to be honest, I think 7 or 9 interventions that have been found to be effective in preventing child maltreatment. And parenting and family skills training is one of them. So that is why, an additional reason why I try and promote parenting and family skills training, because not only it has been found to be effective in preventing drug use, but also in preventing child maltreatment. And Inspire is just the publication with all of the list of intervention. And the WHO and the Violence Prevention Alliance are disseminating this knowledge through many different means. And we are part of that. So we're very proud of that.
Before I move to our last question, Giovanna, a lot of our attendees are asking if the presentation will be available to them. Is it possible to share it?
Yeah, I will send you. I need to clean it a bit because there are a few things that I have taken off the internet and so on. Most of these things are ours, but so I clean it, I put it in PDF, and then you can send it to anybody who is interested. I'm very grateful.
No, again, forgive me for interrupting, so I know it's Giovanna's section, but I'm sure both the presentation could be put on the ISSUP website and on the ISSUP Lebanon website, so people can see it there. And just to also add, because there have been so many fascinating questions, that I would refer people to the ISSUP website, issup.net. Particularly, there were questions about the universal prevention curriculum, and there is a section there that people may want to refer to find more information about that. And many other of the questions that people have raised. It's where we try to build the networks and share what people are doing and answer people's questions. So I would encourage, as our new members develop in Lebanon, that they use the website and also build the ISSUP Lebanon website to get and share that sort of information. I apologize for interrupting, but there's so many questions, and poor Giovanna can't answer them all in the time she's given.
No, and in many, you know, the standards are a, how can I say, summary of the science 2 years ago. The science has many gaps, and where there is no science, the next good thing is the, you know, genuine and inspired experience of colleagues. And this is where ISSUP comes in, because in ISSUP, in the website, you will find people from all over the world that have been grappling with very similar ideas and problems to yours, and maybe they have found a solution, or maybe they have gotten an idea. So I think that's not that's super pertinent. It's really important.
Okay, thanks, Giovanna. Thanks, Noel.
Thank you, Jeff, for this useful information. I would also like to add that the webinar will be available. The webinar and the presentation, the webinar is recorded, and it will be also available on ISSUP.net website For those who are in Lebanon, please join and become members. You will keep updated with all the relevant information, and you can stay tuned with all the upcoming activities that are happening. Now, Giovanna, I'll move on to the last question, which is, what possible ways are there to reduce stigma and discrimination about drugs within the community to address prevention interventions at school?
You're asking very difficult questions. So, last year, we had an entire meeting only dedicated to the issue of stigma and discrimination. And it's such a difficult issue. And I think that for us as prevention professionals and in general, or also treatment professional, it really starts with us, first of all, to look at the way we speak and we think about people who use and people with drug use disorder, and really pay attention to the way that we address the issue, that we don't make it more difficult for people who use drugs and people who use disorder with drug use disorders, and or imply that it's their fault, that it's their weakness, that is there's something wrong with them. But really recognize, as I was mentioning earlier on, that people are made vulnerable. They're not born vulnerable. They're made vulnerable by very difficult circumstances. And in fact, they have demonstrated a lot of strength by surviving so far. And they just need our support into flourishing in healthy beings, healthier beings. So I think that that really starts with us, and with being careful when we develop a prevention and treatment interventions, that we don't inadvertently increase a stigma around people who use drugs or people with drug use disorder. And this is another benefit of working with evidence-based prevention for two reasons. One, a lot of the work is really not about drug use. It's really about children, helping children and youth develop their personal and social skills in general. So we are not talking about pointing the finger or stigmatizing or labeling and so on and so forth. And also, you're using interventions that have been found to be effective already, and they have been found to cause no harm, which is also very, very important. And so this is not a solution by any means. We are all thinking about this very difficult issue. But they are two important points that I would like to offer to all of us to keep in mind in our practice of prevention and treatment.
Okay, so we're done with the Q&A session and the webinar. Giovanna, I would like to thank you again for your support and for accepting to be our guest speaker for our first webinar. Thank you so much. And thank you for all the attendees. Thank you.
And thank you. And I hope to hear from many of you. The only problem with this webinar, which I'm really, really happy to have done otherwise, is that I don't see the people, right? I only see you, which is great, of course. But, to all of you who are hiding behind my screen, thank you for having me and be in contact. And good luck in your great work on prevention and treatment.
Thank you. Thank you.